In the past, high blood pressure was an issue of elderly, but recently the situation has changed completely, and not for the better. Nowadays, hypertension is quite often found even in young people. High blood pressure can be almost asymptomatic. Usually the first signs are general weakness of the body and dizziness, then the sleep worsens and constant fatigue appears. The blood begins to rush to the head, so blurred vision and nausea become common parts of the life. This phase of the condition can last for several years. After that, circulatory disorders of the brain, renal failure, and cardiac pathologies usually begin to develop. If no therapeutic measures are taken at the early stage of hypertension, the condition may lead to heart attack and even death. High pressure can cause arterial dissection, retinal abnormalities, blurred vision, and even complete blindness. Nowadays, most people are frivolous about high blood pressure. Although it's a common knowledge that this is the main factor of cardiovascular diseases development, scientists have found that more than 42% of the world's population have high blood pressure, and this number increases constantly. Why does blood pressure increase? The main causes of increase are bad environment, genetic predisposition, constant stress, anxiety, and high physical and emotional loads. The more often you're stressed and anxious, the more likely you are to get hypertension. You can avoid serious health consequences if you monitor your pressure and take some preventive measures. But many people simply cannot feel the symptoms of hypertension. After all, some of them appear only after physical exertion or in specific life situations. Before we move on, make sure to subscribe to the channel to watch the new episodes on Big Progress. We're doing our best to create interesting content for you. High blood pressure is classified as primary essential hypertension or secondary hypertension. About 90 to 95% of cases are primary, defined as high blood pressure due to nonspecific lifestyle and genetic factors. The remaining 5 to 10% of cases are defined as high blood pressure due to an identifiable cause, such as chronic kidney disease, narrowing of the kidney arteries, an endocrine disorder, or the use of birth control pills. And now we're going to tell you about the most frequent causes of hypertension. Unhealthy diet. A diet that is too high in sodium and too low in potassium puts you at risk of high blood pressure. Eating too much sodium, the main component of table salt, may increase blood pressure. Most of the sodium we eat comes from processed and restaurant foods. Potassium, in turn, balances the amount of sodium in your cells. A proper balance of this element is critical for good heart health. If you don't get enough potassium in your diet, or you lose too much potassium during dehydration or other health conditions, sodium will build up in your blood. Some countries even have government programs on salt intake reduction, and they show excellent results in hypertension prevention. Drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than 1 drink a day for women and more than 2 drinks a day for men will definitely affect your blood pressure. And if you do drink alcohol, do it in moderation. For healthy adults, the norm is 1 drink a day for women and 2 drinks a day for men. 1 drink is 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of 80 proof liquor. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increases in blood pressure. Not being physically active. Inactive people tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the pressure on the walls of the arteries. Lack of physical activity also increases the risk of being overweight. Using tobacco. Not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke can also increase your heart disease risk. And now, as the title of the video states, we will tell you about the top 8 signs and symptoms of high blood pressure. Headache. Headache is one of the most obvious symptoms in both men and women. It can be caused by weather change, great physical exertion, or stressful situation in which the blood vessels of the brain are subject to strong pressure. As it rises, the blood vessels constrict, which causes spasms and pain. The intensity of the pain depends directly on the increase of pressure level. If the normal values are slightly exceeded, the person will feel dumb pain in the area of the temples in men and in the back of the head in women. The condition may worsen after sudden motions, bends, or hard physical labor. However, with this pain, the person will still be able to work. If the normal pressure values are exceeded significantly, then the head will ache severely in the temple areas, and there will be a strong sensation of heaviness in the eyes. It will be difficult to react to sounds and lights, and the person will not be able to work effectively. It's important to remember that a headache always goes in tandem with an increase in blood pressure, but this can also be a sign of many other diseases. General weakness of the body. Weakness in the body is another sign of high blood pressure. It's impossible to say for sure at what pressure value a person begins to feel weak. It depends on the characteristics of the body. Some people literally suffer at 150/100 pressure, while others feel quite well even at 180/130. Most often, weakness occurs in people who are not used to high blood pressure and haven't had hypertension. Also, this symptom can occur after a hypertensive crisis, which is a sharp drop in pressure. In this situation, the person will experience severe headache, nausea, tachycardia, and blurred vision. In some cases, they may also feel numbness in the arms and legs. Strong dizziness. Dizziness is one of the most dangerous signs of high blood pressure. In fact, this symptom indicates a malfunction of the vestibular system. If you feel dizzy, try to go to bed and relax as soon as possible. Otherwise, there's a risk of injury. Dizziness is also one of the first signs of loss of consciousness, stroke, heart attack, cerebral hemorrhage, pulmonary edema, and other bad conditions. If you have recently experienced sudden dizziness, make sure to consult a neurologist. Sudden nausea. Disruption of the work of stomach and intestines is another symptom of high blood pressure, which can be similar to an intestinal infection. 1 out of 4 people experience vomiting when the upper pressure indicator increases by 40 to 50 millimeters of mercury, and 65% of people experience vomiting when systolic pressure rises 1.5 times. Sharp increase in blood pressure accompanied by vomiting is a signal of violation of blood circulation in the brain, which can cause a stroke. Call the ambulance immediately in case of this symptom. Hyperemia. If your face turns red for no reason, this may also be a sign of increased blood pressure. How often the redness appears depends on how long you have been suffering from hypertension. 30% of patients with frequent pressure increases experience this symptom, and in 50% of patients, small bruises appear. In this condition, nosebleeding and bursts of eye vessels and capillaries are also possible. However, you should not be afraid of these symptoms, as these are the natural mechanisms that prevent cerebral hemorrhage. Angina. Angina, also known as angina pectoris, is chest pain or pressure, usually due to not enough blood flow to the heart muscle. It's usually caused by obstruction or spasm of the arteries that supply blood to the heart muscle. Other causes include anemia, abnormal heart rhythms, and heart failure. The main mechanism of coronary artery obstruction is atherosclerosis as part of coronary artery disease. Worsening angina attacks, sudden onset angina at rest, and angina lasting more than 15 minutes are symptoms of unstable angina. As these may precede a heart attack, they require urgent medical attention and are in general treated in similar fashion to myocardial infarction. Severe shortness of breath. Increase of blood pressure may cause the appearance of respiratory disease symptoms. Increased breathing rate is okay right after a workout, but if it occurs for no reason, then you can consider this as a symptom of hypertension. Because of high blood pressure levels, the internal organs may simply not get enough oxygen, which means that breathing will become difficult. It's necessary to monitor blood pressure and to reduce it with medications if it's too high. Otherwise, there's a risk of developing heart failure. In case of severe shortness of breath caused by hypertensive crisis, you should immediately call the ambulance. Tachyarrhythmia. Tachyarrhythmia is a heart rate that exceeds the normal resting rate. In general, a resting heart rate over 100 beats per minute is accepted as tachycardia in adults. Heart rates above the resting rate may be normal, such as with exercise, or abnormal, such as with electrical problems within the heart. Tachycardia can lead to fainting. When the rate of blood flow becomes too rapid, or fast blood flow passes on damaged endothelium, it increases the friction within vessels, resulting in turbulence and other disturbances. According to the Firkos triad, this is one of the 3 conditions that can lead to thrombosis, which is the formation of blood clots within vessels. The upper threshold of a normal human resting heart rate is based on age. From 8 to 11 years old, tachycardia is more than 130 bpm. From 12 to 14 years old, tachycardia is more than 199 bpm. In adults and teenagers over 15 years old, tachycardia is more than 100 bpm. If you notice the symptom, make sure to consult a specialist. What should you do in case of high blood pressure? The main point you need to remember: don't prescribe medications to yourself. Trust examination and diagnosing to a professional doctor. Do physical exercises if you can, and if it brings you pleasure, walk on foot as often as you can, in a forest or in a park. Don't sit at a computer monitor, TV, or smartphone all the time. Also, for people with high blood pressure, it's better to get rid of excess weight. An overweight person is always at risk of hypertension. Reduce the consumption of salt, coffee, smoked meats, sugar, and especially convenience foods and fast foods. From now on, fish, garlic, bananas, and raisins are your best friends. Eat more tomatoes and strawberries, raw carrots, and other vegetables. And remember that the most important advice on high blood pressure is to consult a doctor if you find any symptoms mentioned above. That's all we wanted to tell you today. On this channel, you will find videos about the benefits of different foods, about diseases and effective methods of their treatment, as well as interesting information about housekeeping and gardening. So make sure to subscribe to Big Progress and ring the bell. Click the like button under the video and share it with your family and friends. See you soon!